More of those good news regarding advanced technology services. We're very pleased to welcome on the line Dr Sibongiseni Dhlomo, who we just saw in the insert. He is the KwaZulu-Natal Health MEC. MEC, a very good afternoon to you. Thank you so much for joining us. Tell us more about this great partnership with the MEC services. How did it come about?
Good afternoon, ma'am, and good afternoon to all the SAF TV listeners and viewers. No, we have had this partnership going on. I think it was influenced by what we have really heard from the presenter, there being a very mountainous and a very big, large province, where, in fact, to move from Kokstad to Durban, it takes 4 hours on the road. And to move from Ngwavuma, which is the border of Mozambique, Swaziland, it takes another 4 hours to go to Durban. Now, if you were to have a major accident in and around Kokstad or Ngwavuma, we want to give a service to our patients just as good as if they were just on the doorstep of Durban. There's this thing we talked about as a golden hour. If someone is injured severely, you need to, within an hour, make sure you get that person being attended to, resuscitated, and get the drips and blood ordered. Now, you can only do that if you bypass these 4 hours on the road and get the 1 hour on the ambulance into Nkosazana or any of the tertiary hospitals. For as long as we live, there can never be a specialist in any of our far-flung hospitals, cardiologists, neurosurgeons, and all that. So if you have such a complicated patient in those far-flung areas, you will then need to bring that patient to the center where there will be all specialists to attend. And the only way of doing that is actually to have this air ambulance coming in there. Number two, when those patients have been seen and have been discharged from these big centers and they are back to Kokstad and Ngwavuma, it is easier and cost-effective to fly a doctor into those areas and do reviews there, rather than to get all the patients who have seen over the past 3 months, hundreds of them, into Durban. You rather have them. So this air ambulance is also going to serve as get the doctors our specialists in the morning in a flight, go and keep and put them in Ngwavuma, Kokstad, or Newcastle. They stay there the whole day. They review all those patients who otherwise were complicated in Durban, and therefore it becomes extremely cost-effective, and you then can sustain patients for a very long time.
All right, and these patients, MEC, we're talking about everybody, both on even those that are not even on medical aid. But let's also talk about the rollout. Has it started? And I did hear you talking to us about the process of how, of course, a patient could get assistance. But talk to us about that. Is there a certain number that they need to call and so forth?
No, if it is big, it is when they are attended by our own ambulances in those far-flung areas or are seen by the hospitals. So what we say, if there is a road ambulance that gets a patient in Nongoma, and the patient is then that complicated, then that ambulance of ours will be contacting the air, because it's the same service, ground or air. So those who are on the ground will then say, we have a patient here who is a polytrauma, head injury, both limbs, all the 4 limbs are broken, there's an abdominal injury. This patient has to be in the city center, in the bigger hospital. Please, can you send an air ambulance? So within 20 minutes, the air ambulance will be there, and within 30 minutes, the patient will be there in Durban and bypass the whole of that 4 hours on the road.
Absolutely awesome, Doctor. Now, you also spoke about the far-flung areas. Any earmarked for prioritization in these areas, in the provinces?
Yes, look, we can actually dissect our province. If there's an air ambulance leaving Durban, goes to the south, it goes right into Kokstad, which is an area that is in the border of Eastern Cape. If there's one going north, it goes into Richards Bay and goes to Nongoma and goes to Mhlabya-Lingana or Jozini area. It's one line. The other line goes from Durban straight into Newcastle.
All right. And how many aircrafts are we specifically talking about here, Doctor?
We have 2 fixed aircraft, and then the other ones will be, there are 3 helicopters. So a helicopter will only go and pick one a patient or two at a time. But this fixed air wing is about 8-seater to transport that number of doctors and also have a space to keep patients in there. So there are 2 of those aircraft, a fixed wing, and there's about 3 helicopters.
All right, and Doctor, just to very quickly wrap up this interview, where can people get more information about this new initiative, those that might still be confused as to how it actually works?
The service is quite simple. It's the doctors on the ground who will decide whether you need a road or what. First is to actually, we are in link with other private ambulances, but first port of call will be our ground ambulance people to arrive at the scene of accident and come to a decision that this is much bigger than the district hospital. It needs that type of hospital. There, then they phone and get the air ambulance, the helicopter to come right there and pick up patients.
I see. Thank you so much, Doctor. We're going to leave it there. Thank you so much for your time on this Sunday afternoon. That is KZN Health MEC Dr Sibongiseni Dhlomo talking to us about this new interesting partnership with the Department and Air Services for patients in hard-to-reach areas.